I've been here at Blue Cross for about 2 years. I started out in the Medicare sales department, moved up to a full-time employee. I now work in the individual business unit as a health plan advisor.
I love my job here. I get to help people. I get to help people understand very complex situations, very complex products, and help them make a good decision and ultimately something that they're comfortable with. And that's something that I get to take home a smile about every day.
I came through Blue Cross after spending about 8 years in Detroit Public Schools as a substitute school teacher. Spent about 10 years with the post office prior to that, and had about 10 years with a call center. So a lot of different work backgrounds, always working with people in some way, either instructional or, if not instruction, financial advising, as well as just general customer service.
I've been a health plan advisor at Blue Cross Blue Shield of Michigan for the past 2 years. Prior to that, I did work in the health insurance field really for about the last 8 years. So pretty much been doing it all my life.
Why is insurance important? I actually often tell people on the phone that this is the only thing you're ever going to purchase that you really hope you don't have to use.
One good reason is you never know when an accident may happen. You never know when your child may be sick and need to go see a doctor. So health insurance protects you against the high cost of health care, as well as prepare you for the worst thing that could happen.
There's always the question of the unknown. You never know what can happen, when it can happen, and really the big thing is, the financial aspect of it. You never know how much it's going to put a dent in your own pocket.
I enjoy working as a HPA because it gives me a chance to work with individuals and help them to understand something that they're very concerned about as far as health insurance for themselves and their family, and also getting a chance to interact and find out what their needs are and explaining something that most people are confused about. Many people know they want insurance but don't have any idea as to what kind, how, what it'll cost, or how to go about getting it. So helping them is very rewarding to me.
You could wake up one morning with back pain, go to the emergency room before you know it, have to have your appendix removed. Health insurance can definitely help prevent some of those extreme out-of-pocket costs.
At the end of the day, the only bad decision that you can make when choosing an insurance policy is not taking one at all. You want to look at the benefits that you think you're going to use. If you take medication, you want to look at prescription benefits. If you're an athlete, you might want to look for things like physical therapy. But be honest with yourself. Try to find the best balance point between the protection you're buying and what you're going to pay for it, but ultimately get yourself insured, because it's the number one reason people get foreclosed or have to declare bankruptcy, lose their home, their possessions, because of major medical bills. So please insure yourselves.
That's one of the best parts about my job, is getting this has been the most confusing part of anything I've ever had to do in life, and for you to be there every step of the way, I really, really appreciate that, and we hear that all the time. So for me in particular, that's probably the best part of the job, is just knowing that I've been able to educate somebody and really give them the answers to help them make an educated choice.
It's not something that needs to be, it shouldn't be thought of as an afterthought. It's something that is, you need to be prepared for, you need to think ahead for, so you have the protection, if not for yourself, at least for your family, so your family doesn't get stuck with these medical bills. You gotta think about the future in that regard.